Hello everyone, this is Dr. Shalini Gupta at the Dermatology Laser and Vein Center, and today I thought we would talk about Coolsculpting, which is a procedure that most of you are very familiar with by now, I am sure, because it has in a way become a household name. If you want to get rid of fat without surgery, without liposuction, most people think of Coolsculpting. I'm just going to go get my fat Coolsculpted off. And it has become a very popular procedure for good reason. It works well and there is no recovery time, and it's fairly easy for patients to get it done. So what is Coolsculpting? So Coolsculpting uses cold technology to basically freeze the fat cells, but without causing damage to your nerves or your skin. And it does this in a very precise manner, where the machine cools the fat cells to -10°C, but there is no damage to the skin or frostbite because it continuously monitors the exchange of heat coming up from the surface of the skin. So there are amazing safety parameters built into the Coolsculpting machine that help to specifically target the fat cells but not damage any surrounding tissues. Now, initially when Coolsculpting first came about in 2011, the procedure did have some side effects for patients with prolonged sensation recovery in terms of feeling a burning sensation or pain afterwards, and also potentially causing ridges and things like that. So in 2011, we chose not to get Coolsculpting in our practice because we didn't feel it was perhaps the best technology at that time, but we have a lot of other technologies in our office that we started performing instead of Coolsculpting that were giving really great results. But in 2017, the company made a nice upgrade to the machine where they took some of these factors into account, and the scientists were able to figure out some of those problems. And once they fixed those problems and we felt now that we're not going to have the complications for our patients and we're going to get nice results, we chose to introduce it to our patients, and it has been, of course, very popular. So again, very safe procedure. Since 2017, the upgrades in the Cool Advantage technology were made, and we're really excited to have it and to offer it to our patients. So the way the Coolsculpting procedure works is basically you just relax. We mark out the areas of the fat buckets that need to be addressed, and you need to have pinchable fat in order for the Coolsculpting procedure to work best, because without pinchable fat, it can't grab the fat into the suction cups of the machine. But if you don't have pinchable fat, you don't have to worry, because we have a solution for that as well, and we can use other technologies. But if there is pinchable fat, then we often like to start with Coolsculpting to really debulk some of those areas. And so there are different applicators that come with the technology. This is the machine itself, and then there are different hand pieces that of various sizes to fit specific areas of the body. So for example, we can treat the chin, we can treat the pesky bra fat area, we can treat arms, we can treat back fat, love handles, stomach, inner thighs, outer thighs. So those are all the areas that we target with the Coolsculpting machine. This particular applicator is called the Cool Advantage Petite, and it has a little smaller footprint, so it's great for areas like the arms, it's great for the areas like the bra fat possibly, although sometimes we'll use Cool Mini there. And again, it's a really artistic procedure because it's not like one size fits all, and although it's fairly straightforward, it's not, because there is an artistic component to how the applicators are placed, what patterns are made on the skin, so that you get a nice smooth outcome and an artistic sculpting of the body rather than just reduction of fat. So let me show you some of the other applicators. This one here is called the Cool Mini applicator, and this one basically just kind of sits on the chin. So we just place it right under the chin, and it's able to freeze the fat in that area very nicely and contour the shape of the chin. And then this one here is the Cool Advantage Plus, which is a much larger applicator, as you can see, and this is great for bigger areas. So for example, if we have a larger stomach to treat, we'll use the Cool Advantage Plus so we can grab more fat at one time. The Cool for the outer thighs, the applicator is not a suction applicator. It is a flat applicator that sits on the skin, essentially, and we leave it on there. This applicator takes about an hour and 15 minutes to complete, and it's able to freeze the fat from the outer thigh. And then we have the Cool Advantage applicator, which is our most often used applicator. And this one, you can see, is the standard size. So it's a little bit bigger than the Cool Mini and the Cool Petite. So that is, in a nutshell, what the procedure looks like. It's a fairly comfortable procedure. For the first 5 minutes or so, you will feel a cold sensation, but after 5 minutes, the skin goes numb and then you don't feel anything. So most of our patients just relax and they can work on their iPads or their computers or their iPhones. Many patients just take a nap, and we also have a TV with lots of movies and channels, so you can entertain yourself that way and just make it a nice spa day. But you know, very comfortable procedure, really no downtime. And I'll show you some before and after images now, as well as kind of picture-wise what it is doing. So this is a graphic showing fat cells in yellow. During the procedure, you can see the blue cells represent the cells that have been frozen. And then with time, those fat cells begin to die off, and then you're left with fewer yellow cells at the end. So essentially, that's how it reduces the fat. And the technology came about from the Harvard Medical School with in the lab of Dr. Rox Anderson at the Mass General Hospital, and they discovered that children who had popsicles that they would leave in their cheeks or in their mouth for extended periods of time would develop dimples because they were essentially losing the fat from that area. So that's where the idea came about, that fat is easily targeted by cold. But fat is also easily targeted by heat, and some of our other technologies work on the concept of heating the fat cells to kill them. But this particular technology works on the concept of cooling the fat cells to kill them. And it does that again in a very precise manner, so it is safe, effective, and accomplishes what it's set out to do. So here are some pictures of Coolsculpting, for example, using the Cool Mini applicator, which is the little one for the chin. And you can see a really significant reduction in chin fat, and this is non-surgical without liposuction. Of course, I also offer liposuction, so if somebody wants to get these results in a single treatment and be done with it, then we can do that. But with the Coolsculpting, you can also accomplish a similar result. It just may take a little bit longer to get there, and you may have to do it more than once. So here's some more examples of the chin fat. This is that pesky bra fat that I was alluding to earlier, and then it's also excellent for that back fat that's very stubborn to treat. Some more examples of back fat with Coolsculpting. This is the posterior thigh area. Some examples of the stomach, and this is after the third session, 3 weeks after the third session, and you can see here that the pattern of applicator that is used has to be scientifically and aesthetically laid out to give the best results in terms of contouring. This is another example before. This is 8 weeks after the first session, and here we are 8 weeks after the second session. So the first session, you can see a larger applicator was applied to the lower stomach because that's what it needed at that time. But after the first session, then a different pattern was chosen to complete the treatment and give a nice aesthetic outcome. Because the last thing you want is to be left with ridges or dimples or fat loss where you don't want fat loss. So we really want to target the bulges. Here's another example before, after the first treatment, after the second treatment. More stomach photos before and after. Stubborn back fat, love handles. Another beautiful result on that skin there. And it's interesting too because technically the cold technology is not associated with building new collagen or tightening the skin like some of our laser and heat-based technologies are more prone to do. However, we have noticed that for some reason, Coolsculpting and the cold also is able to, in some cases, generate new collagen and give us a skin tightening effect. So that's been pretty exciting to see. Here's another example of back fat where there's pinchable area that can be targeted. Here are some examples of the inner thighs. And some more inner thigh pictures. More of the inner thigh. And just a couple more images showing the chin and stomach. So I hope you enjoyed that. I hope it was informative and educational. And I hope that you all stay safe. And when you're ready and you come out of your quarantine, then come and visit us and get yourself Coolsculpted. All right, have a wonderful day and be well and be safe.